Aujourd'hui, je discuterai des plus récentes données sur le nombre de cas au Nouveau-Brunswick ainsi que l'éclosion présentement en cours dans des établissements de soins pour adultes. Today, I will be reporting on our latest case numbers, including outbreaks now underway at adult residential facilities. As I have said for the last 2 days, our situation is grim, but that's a relative term when you look at what's happening in other provinces. However, we do expect things to get worse here before they get better. Because of the Christmas and New Year's holiday gatherings, this season is over, but the infections that we have seen as a result of gatherings over the last days of 2020 are still emerging as we move through the first full week of 2021. You can expect that we will see more new cases and more hospitalizations in the days ahead. Le virus responsable de la COVID-19 ne prend pas congé. Il ne respecte pas nos traditions familiales ni nos frontières. Il n'est pas nécessaire de chercher bien loin pour voir à quel point les choses peuvent mal tourner. COVID-19 virus does not take holidays. It doesn't respect our family traditions, and it doesn't respect our borders. You don't have to look far to see how bad things could get. The Bas-Saint-Laurent region in Quebec, immediately to the north of us, reported 90 new cases over the weekend. Washington and Aroostook counties in Maine on our western border reported 42 new cases on Tuesday, and that's a small fraction of the nearly 600 new cases reported throughout Maine on that day. The province of Quebec has more than 24,000 active cases, and this weekend will impose a dusk to dawn daily curfew in Quebec. The state of Maine has more than 15,000 active cases, a number that is growing by 500 cases each day. We don't want to see this happen here. Everyone in New Brunswick must follow public health direction and advice so that we do not face similar outbreaks here. Everyone has a role to play in bringing our situation under control. We do have border measures in place. We do have recommendations around mask wearing. We do have recommendations about keeping your close contacts low. We do have recommendations about staying at home unless you absolutely have to go out for work or school or a medical appointment or to get some fresh air outside. We do have a lot of things in place to protect us at this moment in time. So the transmission that we're seeing right now is some of the asymptomatic transmission from people who only found out they were infectious after they were diagnosed with COVID-19 at this point in time. So that's why it's really important for people to be very aware of where they've been, be very aware of if you have symptoms, to get tested right away, and stay home if you're not feeling well. Don't go to work, don't go to school, don't go to any gatherings, etc. And don't take this all for granted at this moment in time. J'annonce aujourd'hui qu'il y a 24 nouveaux cas de COVID-19 au Nouveau-Brunswick et ils se répartissent comme suit. Il y a 5 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de St. John, de Kings et de Charlotte, il y a 2 nouveaux cas. Dans la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick, il y a 7 nouveaux cas. Il y a 5 nouveaux cas dans la zone 4, soit la région d'Edmundston et de Grand-Sault. Il y a 5 nouveaux cas dans la zone 5, soit la région de Campbellton-Restigouche. Nous avons maintenant dépassé au total le cap de 700 cas d'infection signalés depuis le début de la pandémie. Il y a présentement 130 cas actifs au Nouveau-Brunswick, incluant une personne hospitalisée aux soins intensifs. Today, there are 24 confirmed new cases of COVID-19 in New Brunswick as follows. In Zone 1, which is Moncton and southeastern New Brunswick, 5 new cases. In Zone 2, which is the St. John, Kings, and Charlotte counties, 2 new cases. In Zone 3, which is Fredericton and central New Brunswick, 7 new cases. In Zone 4, which is the Edmundston, Grand Falls region, 5 new cases. In Zone 5, which is the Campbellton-Restigouche region, 5 new cases. With these new cases, we have passed 700 total cases since the beginning of the pandemic. There are now 130 active cases in New Brunswick, including 1 individual who is hospitalized and is in intensive care. And we have about 800 people self-isolating at home as a result of either having COVID-19 or having to self-isolate because they are close contact of somebody with COVID-19. Again, I ask that you keep these fellow New Brunswickers in your thoughts and prayers today. We are again facing outbreaks in adult residential facilities whose residents are particularly vulnerable to the COVID-19 virus. And the fact that we have multiple outbreaks happening around the province in multiple vulnerable settings is unique. We haven't faced this situation before. And so when I talk about how serious things are, that is what I'm referring to. The fact that we've experienced this in one zone at a time, possibly two, possibly three. But right now this is spread across the entire province with the exception of 2 zones. And we have actually had some conversations with the leadership in those areas to let them know how much we appreciate their support right now and understanding of this provincial approach that we have to take right now to address all the risks around COVID-19 and getting these outbreaks under control as quickly as possible. Hier soir, nos équipes provinciales de gestion rapide des éclosions ont été envoyées à Canterbury Hall, un foyer de soins spéciaux de 60 lits situé à Riverview, ainsi qu'au manoir Fundy Manor II, un foyer de soins spéciaux de 28 lits situé à Hillsborough. Après la découverte d'un cas dans chacun de ces 2 établissements, Santé publique a entamé une enquête aux 2 endroits. La recherche des contacts a débuté et les membres de l'équipe provinciale de gestion rapide des éclosions commenceront aujourd'hui à faire subir des tests de dépistage aux résidents et aux membres du personnel de ces établissements. Last night, our prompt teams were dispatched to Canterbury Hall, a 60-bed special care home located at Parkland, Riverview, and to Fundy Manor II, a 28-bed special care home located in Hillsborough. Following a confirmed case at each facility, Public Health has started an investigation at both facilities. Working with the facility staff, contact tracing has commenced, and members of the PROMPT team, which is the Provincial Rapid Outbreak Management Team, will conduct testing of the facility's residents and staff today. Concerning Parkland St. John, 3 employees have tested positive. The number of confirmed cases now stands at 11 residents and 7 employees. All of New Brunswick is now at the orange alert level, which has put limits on everyone's movements and interactions. This is being done to keep everyone safe. We have more active cases now than at any point during the pandemic, and there are hundreds of New Brunswickers in self-isolation. Aucun citoyen ne devrait faire l'objet de pression du public dans les médias sociaux ou ailleurs parce qu'il aurait pu avoir contracté le virus. Personne ne cherche à contracter le virus et je suis convaincue que personne ne cherche à contribuer à la propagation du virus. Mais cela arrive quand même, sans savoir. Veuillez traiter vos concitoyens du Nouveau-Brunswick avec gentillesse et compassion. No one sets out to get COVID-19, and I'm sure no one sets out to spread the virus. It happens without our knowledge, but it's happening all the same. Please treat your fellow New Brunswickers with kindness and compassion. No one should be subjected to public pressure on social media or elsewhere because they may have had the virus. And nobody should put pressure to attend events or settings of school or work by employers, etc. Nobody should have pressure put on them to go outside of their home when they are not feeling well, when they have symptoms of COVID-19, and when they should be getting tested. Je tiens à remercier toutes les personnes qui s'isolent présentement, ainsi que celles qui aident des membres de la famille et des amis à traverser cette épreuve. Vous sauvez des vies. Vous pouvez également contribuer à l'effort en téléchargeant l'application d'alerte COVID-19 sur votre téléphone. C'est très, très, très important. J'ai reçu un message d'un des médecins hygiénistes dans la région de Moncton qui dit que, au fur et à mesure qu'ils font les enquêtes, les recherches, la plupart des gens n'ont pas l'application d'alerte COVID-19 et ça nous aiderait tellement. Les staffs dans les régions ont tellement besoin de votre aide à ce moment-ci. Et si vous pouvez prendre l'application Alerte COVID et le mettre sur votre téléphone, ça nous aidera tellement. C'est quelque chose de très simple et l'application aidera à limiter la propagation des infections. Apple a récemment apporté des modifications qui permettent d'utiliser l'application sur ses plus vieux modèles de téléphone. Elle sera ainsi plus facilement accessible pour de nombreux citoyens du Nouveau-Brunswick. Nous avons parcouru beaucoup de chemin ensemble depuis le début de cette pandémie, mais il reste encore beaucoup de chemin à faire. Please take every opportunity to help a friend or a neighbor who is currently self-isolating, and there are hundreds of New Brunswickers now in this situation. Take this opportunity to contribute to your community by buying local, shopping local, taking time to order in from local restaurants or ordering in from local restaurants. I do want to thank everyone who is now self-isolating, as well as those who are helping family and friends through this. You are saving lives. It is extremely important at this time that everyone who can download the COVID-19 Alert app to your phone do so immediately. It is an important and simple step that will help limit the spread of infection. I received a message from the Regional Medical Officer of Health in the Moncton region, Dr. Legere, and he is saying that during the investigations, they are finding that very few people have downloaded that app, and it would help them tremendously in tracking down the cases all around the province in terms of contact tracing and getting people to self-isolate immediately. This is such an important step right now. I urge everyone who can to download the COVID-19 Alert app immediately. Please share this widely. Apple has recently made changes that allow the app to be used on older models of smartphones, which makes this more accessible for many New Brunswickers. We have come such a long way together since this pandemic began, and we still have a long way to go. There is a light at the end of the tunnel, and I know that, again, based on everything we've done so far, we have overcome all of the challenges that we've been faced with thus far, and I am confident that we can continue to do so. With every vaccine dose injected into a New Brunswicker's arm, with every person who wears a mask in public and maintains physical distance, with every person who stays home when they don't feel well and seeks testing when symptoms of COVID-19 emerge. I thank everyone who is taking these actions. Please keep doing these things. They are making a difference, and if we all work together, we can overcome these outbreaks and put our province back on track. Thank you very much.
Good afternoon, bonjour. As Dr. Russell has stated, prompt teams have been dispatched to 2 more long-term care homes in the province. There is also a school in our province that is closed today due to COVID-19. A positive case has been confirmed at Bessborough School in Moncton, and the school community has been notified. Students stayed home today for an operational response day, and staff will reach out to families directly should there be any other impacts on learning. The virus is impacting more than schools and nursing homes, however. We currently have 500 people in our province who are self-isolating on orders from public health due to possible exposure to the virus. This is a reminder of how serious the situation in our province is and why it is necessary for us to move all zones in New Brunswick to the orange alert level. While we will see the impact of that decision in the days to come, we must continue to act quickly and decisively to protect our residents in our province. One way we are doing this is by taking steps to reduce the risk from travel as much as possible. It is impossible to stop all travel into and out of our province. People need to be able to work, and goods must be delivered. However, it's important that we do what we can to prevent the UK strain of the virus from entering our province. It has been reported in other areas of Canada, and we must be vigilant. We are currently finalizing updated travel-related information and will have more to share about that tomorrow. What we must all continue to work together to slow the spread of COVID-19, and one way we can do this is by following the rules and policies that we have put in place. Public health is working hard to keep us all safe, and what they are asking us to do is not complicated. At the orange alert level, we must all stick to our single household bubble. This includes the people that you live with, and if necessary, one other person who needs support. Also, wear your face masks. Face masks are mandatory in all indoor public spaces and in outdoor public spaces when physical distancing of 2 meters cannot be maintained. A full list of what is required at each of the alert levels can be found online at the GMB website on the coronavirus page under NB's Recovery Plan. Another step I encourage everyone to take is to download the COVID Alert app. The exposure notification app is available in New Brunswick. The app provides a one-time code that alerts other devices via Bluetooth if they have been exposed to someone with COVID-19. The app uses strong measures to protect the privacy and confidentiality of any data it collects, and it does not track a user's location or collect personal identifiable information. This is a safe, easy way for you to protect yourself and your community. I want to thank everyone who is following the rules, who is trying to do the right thing to protect themselves and others. I believe that the majority of New Brunswickers fall into this category because at heart we care about one another in this province. I also recognize that following the rules isn't always easy. We miss our family, we miss our friends, and we miss the way life used to be. But the steps we are taking today will save lives. And there is light at the end of the tunnel. The vaccine rollout in our province is underway. As of this morning, 5,019 people in New Brunswick have received the first dose of vaccine. By the end of this week, we will have administered more than 7,500 doses. The 1,871 people who received their first dose of vaccine at a clinic in Miramichi in December will be the first to receive their second dose this coming weekend and be fully inoculated. 2 more shipments of vaccine, totaling 6,600 doses, are expected next week. Please remember, even as the vaccine rollout and as more and more New Brunswickers are vaccinated, we must continue to take the steps necessary to protect ourselves, as well as our families, friends, and communities from COVID-19. It is easy at times like this to focus on the negative, such as the rising number of active cases, but there are positive things happening as well. I encourage all New Brunswickers to focus on those positives, including the actions you are taking to protect yourself and others, as well as the actions others are taking to protect you. This is a challenging time, but over and over we have shown just how resilient we are as a province. Working together, we have stepped up and overcome every challenge we have faced. You should be proud of that. We all should be. Now is the time to continue supporting one another, because that is how we will get through this, by supporting one another and working together. Thank you. Merci.
Merci beaucoup, Minister Shepherd et Dr. Russell. Thank you, Minister Shepherd and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? Chaque journaliste aura une question et un suivi. We'll now proceed with questions from members of the media. Please ensure your microphones are placed on mute. You have the right to pose your question in the language of your choice. Each reporter will have one question and a quick follow-up. Travis Fortnum, Global News.
Hi there. My question is for Dr. Russell. I'm sorry, I missed the number of New Brunswickers who are self-isolating. I'm wondering if you could confirm that. And the other day, Premier Higgs said checks on people who are in self-isolation are going to be stepped up. I'm wondering if you have details of how that's going to be stepped up.
So right now there are 836 people in the province self-isolating as a result of either being a case of COVID-19 as a result of having COVID-19 or as a result of being a close contact of COVID-19. When when the Premier was referring to having checks on people who were self-isolating, my understanding is he was speaking about people who had come in from outside of New Brunswick.
Mr. Fortnum, do you have a follow-up?
Yes, I think we've touched on this in the past, but I'm wondering if you have any information on how many cases have been identified thanks to this COVID-19 alert app.
I don't have any information on that at the provincial level. My understanding is that at the national level they are publishing data on that, but it's not broken down by province.
Thank you, Mr. Fortnum.
And I just want to bring up a question that was raised yesterday around vaccinating during an outbreak, and I did get a bit more clarification on some of the discussion that was had around that. Basically, the clinical trial data for the vaccine, for the Pfizer vaccine, had indicated that the COVID-compatible symptoms, well, either vaccine actually, there are relatively, the side effects of the vaccine itself are similar to symptoms that you would see with COVID. So the concern was raised really that the administration of the vaccine in a facility with an active outbreak would lead to heavier testing and isolation requirements on patients in such facilities, and it would complicate the risk assessment and outbreak control. And following the first round of long-term care vaccinations, we will be reviewing this based on the experiences that we're having to date.
Thank you, Doctor. Andrew Waugh, Brunswick News.
My question is to either Dr. Russell or Mr. Shepherd. Some of the comments you made in the opening there indicate to me that you're worried, obviously the lower uptake on the app that you're hearing. Are you worried that maybe some New Brunswickers still aren't taking this seriously enough?
No, I don't believe that people aren't taking it seriously. I think that there's been definitely an evolution of people receiving information as we have been transmitting it. So throughout the pandemic, as we get new information and we give it to the public to help them understand what the risks are and what they can do about managing those risks, the COVID-19 app has been out there with respect to its availability, and perhaps the understanding hasn't quite been there of how critical it can be in an outbreak situation to have that app available on your iPhone or your other types of phones. And we are just seeing that as the number of cases rise, the contact tracing, in every outbreak it is a challenge. But at this particular point in time, with the increased number of cases, it is more important now, I guess. So if people weren't hearing that message or understanding that message prior to these outbreaks, now is the time to internalize that information and take action. So it's another tool in our toolbox, and each time we have new challenges, we increase our level of response and we increase our level of learning and the opportunities to provide information and education to the public each and every time. So this is one of those areas where at this point in time, this is another tool in our toolbox that we can use that's quite critical to our success at this moment.
Thank you, Doctor. Mr. Waugh, do you have a follow-up today?
Yeah, I do. Again, to Dr. Russell, was there any discussion about going to red today?
Well, every time there's an outbreak in a zone or more than one zone or et cetera, we constantly look at the epidemiological data every day. So on the public health side, we have our epidemiology team, we have our management and public health side of things that are contributing to the discussions in terms of analyzing the data every day. Our triggers are on our website, and those are the things that we use to assess the risks and make decisions about that. But certainly going to red would be a discussion that would be happening at COVID-19 Cabinet all if we were to bring up some recommendations in that way.
I'm just going to add to Dr. Russell's comments and just say that there's a lot of comments and chatter on social media about red, and it hasn't come from government. So, this situation will be assessed every single day. But right now we're in orange. We just came into orange, 2 days ago. And so we need to see what this phase will do to help us get things under control.
Thank you, Doctor. Thank you, Minister. Thank you, Mr. Wall. Laura Brown, CTV.
Hi there. I'm wondering if the vaccine has been made kind of a priority to get the vaccine into Parkland, St. John for staff and for residents there because of the outbreak situation.
I'm just going to build on Dr. Russell's comments earlier, and the fact is that there's public health is still assessing the value of that. We also have to understand that as the COVID-19 in an outbreak situation causes many different logistical problems, and so at this time we will take public health counsel on that, and the idea being that between now and the end of March. Everyone in long-term care will be vaccinated.
Thank you. Ms. Brown, do you have a follow-up?
Yeah, also for Minister Shepherd, wondering about a curfew and if the COVID Cabinet Committee, I believe, did they meet yesterday and was that a discussion when they met?
Again, much like red, curfews are always a part of the conversation, but at this time we've gone to orange, we've implemented some changes, and as those changes are discussed, then we can bring them forward to the public. But I can't say that any option is off the table at any conversation. The COVID Cabinet Committee is very thorough in their discussions, and we work in partnership with public health on those decisions. So at this time, we're in orange with the parameters that are placed around that, and that's where we are, and we'll be assessing on a daily basis.
Thank you, Ms. Brown. Thank you, Doctor and Minister. Mathieu Bois-Como, l'Acadie Nouvelle.
Bonjour, la ministre Shepherd vient de dire qu'il n'y a toujours pas du coronavirus du nouveau type qui a été découvert au Royaume-Uni, au Nouveau-Brunswick. Je me demandais comment on détecte ce type-là différent du COVID-19 et puis donc comment on va le savoir si ça se rend au Nouveau-Brunswick.
Alors, s'il y a quelqu'un qui teste positif pour le COVID-19, puis on suspecte qu'il y a un risque que c'est le nouvelle variant du Royaume-Uni, on va envoyer les résultats positifs à les échantillons, on va les envoyer à le laboratoire national de microbiologie à Winnipeg et à ce moment-là, ils vont faire l'analyse pour faire certaine que c'est oui ou non la variant. Ça prend à peu près une semaine pour avoir les résultats. Alors, à ce moment-ci, on n'a pas reçu des résultats à ce moment-ci pour dire qu'il y a la variant ici au Nouveau-Brunswick, mais on va continuer à surveiller et au fur et à mesure qu'on a des résultats qu'on suspecte peut-être, ça pourrait être la variante, on va continuer à les envoyer à le laboratoire national de microbiologie à Winnipeg. C'est ça.
M. Bois-Como, as-tu une suivi?
Oui, merci. Juste pour être sûr d'avoir bien compris, donc vous avez déjà envoyé des échantillons à Winnipeg parce que vous pensiez que ça pourrait être le type du Royaume-Uni, mais il n'y a pas eu de résultats positifs là-dessus jusqu'à date. Et pouvez-vous nous donner les nouveaux chiffres pour les gens du système de santé qui sont atteints de la COVID-19 ou en isolement? Merci.
Pour les gens qui sont en auto-isolement, soit parce qu'ils ont le COVID-19 ou ils sont des contacts étroits, des cas positifs, les travailleurs de santé qui sont à la maison à ce moment-ci sont 101. Et l'autre question sur la variante, il y a des critères pour envoyer les échantillons au laboratoire. On les envoie toutes. Mais pour l'analyse spécifique pour la variante du Royaume-Uni, oui, on a déjà envoyé des échantillons. Ils ne sont pas retournés encore, mais au fur et à mesure, ça va continuer. Chaque fois qu'on a des inquiétudes où il y a les critères qui sont mentionnés que ça vaut la peine d'aller essayer de les analyser, on va le faire. Ça va continuer parce qu'on sait que le risque va continuer à augmenter. La transmissibilité de la variante du Royaume-Uni est très, très, très haut. Alors, si on avait des éclosions avec ce variant-là, ça serait très difficile à gérer.
Merci. Marie Sutherland, CBC.
Hi, good afternoon. My question is for Dr. Russell. I'm wondering how the province is tracking people to be contacted for vaccine appointments. Once the rollout moves beyond nursing homes, will you be phoning them, emailing, sending letters, and are you confident that you have updated contact information for all New Brunswickers?
So as of right now, for the first group of people, the first phase and the first priority group, those plans are in conjunction with public health and social development and the RHAs. And by the end of, hopefully over the next 3 months, that whole first priority group is going to be vaccinated. And as the rollout continues, the other priority groups will be contacted. Nobody will be left out of the vaccination rollout. So whether you're in the first group or the second group, sometime between June and September, the entire population of New Brunswick who wants to be vaccinated, so hopefully around between 60 and 70, 75% will be vaccinated.
So I'm just wondering, should they wait for a phone call or?
Just to build on what Dr. Russell is saying, this process is also supported by Medicare. So Medicare will help us identify, in the early stages, those who are 85 and older, and they'll be contacted to make an appointment to come for their vaccination. And then as we proceed, as that age limit is lowered to 80, 75, 70, Medicare will be guiding us in that process as well, working with the RHAs and the Department of Public Health.
Ms. Sutherland, do you have a follow-up?
Yes, for a question for Health Minister Shepherd. I understand that the Department of Justice and Public Safety is investigating whether a positive case reported Monday in Zone 5 might be the result of a man from Quebec who came across to play recreational hockey at the Campbellton Civic Centre. What can you tell us about this, and if it's found to be true, what sort of penalties might this individual face?
So travel-related cases, of course, as you know, makes up about 95% of our cases, and so we're trying to be very strict about travel. Public safety could probably offer us more information at this time. I can't really say what the particulars of the cases are, but we are monitoring individuals who cross at the Quebec border. We have some restrictions in place and times that they can come with regards to limiting of that time. And so I think it would be better if we talk to public safety to get you any more details if possible. We are trying very hard not to focus in on individual people, but public safety does have measures in place, and actually you'll hear more tomorrow about travel restrictions and potential consequences.
Thank you, Minister. Thank you, Ms. Sutherland. Natalie Sturgeon, Telegraph-Journal.
Hi, yes, thank you, Bruce. My question is for Dr. Russell. We're hearing from families that the
I think she hung up on herself.
Okay, we'll wait for Natalie to dial back in. Vicky Hogarth.
Thank you, Bruce. My question is either for Minister Shepherd or Dr. Russell. Now that we're a few weeks into the vaccine being in New Brunswick, what have you heard thus far from people who've received the vaccine in terms of what the side effects are? What's the spectrum, if any?
All of the adverse events following an immunization are reportable. So we are keeping track of that data, and we do report that up to the national level. I have not received any information of any adverse events. I think the only thing we're hearing and seeing is localized pain at the site of injection, as far as I've heard so far.
Ms. Hogarth, do you have a follow-up?
I do. I'm just wondering, do you think alcohol played a factor in negatively impacting people's behavior at some of the super spreader events over the holidays?
Well, I can't really speak to that. I can tell you that what we do know about any kind of gatherings that happened, I know people were trying to be diligent about the number of people at those gatherings, but unfortunately, everybody can be vigilant about the number of people, but if one of the people happens to be there who has symptoms, then obviously the risk from having COVID-19 is elevated, obviously, and so that is how a lot of the cases began that are now involved in several outbreaks around the province. And then after those initial events, we're seeing transmission from those people to either their family members or friends or colleagues, and then on to more people after that. But the chain of transmission we're seeing also includes people who were asymptomatic. So again, people can be careful with the numbers, but if somebody's symptomatic or asymptomatic that's participating in any of the gatherings or events or workplace settings, et cetera, then we're going to see more cases. The fact that we're in the orange phase right now means that obviously gatherings are not going to be an ongoing risk. The problem right now is that we still haven't seen the effects of the gatherings that would have happened at New Year's Eve. So over the course of the next several days, we will definitely see more cases around gatherings from New Year's Eve, and then we'll have more outbreaks to deal with as a result of that. But again, hopefully with everything that we know right now and moving forward, if we all work really hard at following public health guidance right now, then again, we can get through these next few weeks as we have with all of the other outbreaks that lasted, from 10 days to 4 weeks. But it will take a concerted effort among the whole entire population of New Brunswick.
Thank you, Doctor. John Chillibeck, Daily Gleaner.
Hi there. Thanks, Bruce. Question for Dr. Jennifer Russell. I was talking to Colin Furness, who's an epidemiologist based out of U of T, who continues to laud New Brunswick's response, says it's one of the best in the country. But he did think within the orange phase, there could be tweaks made that would benefit New Brunswickers even more. For instance, he believes that the most vulnerable group and perhaps the biggest spreaders could be waiters and waitresses in restaurants, given that they are dealing with people who are unmasked, who are seated very close to them. And suggested, why not either move to takeout or do, regular testing of all servers, like every couple of days. Just wanted your thoughts on that.
Well, thanks for your question, John. In terms of transmission, we haven't seen that in any of the levels of orange in any of the outbreaks that we've had. So I think at this point in time, our level of orange has worked for the outbreaks that we've seen in the past. We don't tend to make changes in a phase while we're in an outbreak setting. We usually try to make those changes in between, and it's usually as a result of learnings from our own data and from our own transmission patterns that we see with each and every outbreak. We take that information and use it to adjust whatever we need to adjust for future outbreaks, but I do appreciate the comment.
Thank you, Doctor. Mr. Chillibeck, do you have a follow-up?
Yes. There has been some suggestions that, since New Brunswick is expecting a bigger case count because of New Year's Eve, reveling, in that there will be perhaps a surge in cases, that why not put the province in red right away to sort of nip this in the bud and get it dealt with really quickly and effectively within a week or two. Any thoughts on that?
I'm going to start, and then I'm going to let Minister Shepherd comment. So from a public health perspective, anytime we do a risk assessment to manage anything regarding the outbreaks that we're seeing throughout the pandemic, we want to make sure that the measures that we're imposing match the risks that we're trying to mitigate and manage. It is a little bit challenging to do that without the information, so it's not necessarily a bad idea, but we just know that the ramifications of going to red in terms of what we saw with the first wave were quite negative in terms of unintended consequences and negative outcomes. So those types of discussions in terms of risk assessments we take very, very seriously to take into account all the social determinants of health that we knew were negatively impacted in the first wave. We have adjusted what the red phase looks like, so if we ever did go to red again, it would be slightly different than what we saw in the first wave, but I'm going to turn it over to Minister Shepherd now.
I'm just going to build up a little bit on Dr. Russell's comment about unintended consequences. We saw some of the very drastic consequences of going to red in the earlier part of the year, and of course we were still learning at that point and are still learning now, and with the variant we realized that that our consequences are very real. So, when we go to red, we're closing schools, we're telling employers to, send their employees home. We're making it difficult for parents to find childcare if they can continue to work for themselves. We're making it difficult. I mean, when children are sent home from school, they don't disappear. They have needs that need to be met. So we're trying to be very conscious of the social implications, the economic implications of a red. And that's why every single day, the in-briefings done twice a day are there to analyze the situations that we're in. I have no doubt in my mind if red is required, it will happen. But we're not there yet. We have been in orange for 2 days. We will be assessing it on a daily basis, twice a day, as we've been doing all this week. And the data that we get will drive our decisions.
Thank you. Eloise Rodriguez-Calibache, Radio Canada.
Oui, bonjour, c'est pour la docteure Russell. Vous avez parlé de combien de travailleurs de la santé sont en isolement, mais j'aimerais vous entendre sur la pression sur le système de santé en ce moment. Quel genre de pression ça met? Est-ce que vous êtes inquiet que ça va interférer dans les services de santé? Est-ce qu'on voit déjà des interférences? Est-ce que vous pouvez nous parler un peu de ça?
Oui, c'est une très bonne question parce que dans nos déclencheurs pour regarder quelle est la situation et comment sévère est la situation, les déclencheurs au niveau des systèmes de santé, c'est à propos de combien de lits est-ce qu'on a pour admission, combien de lits est-ce qu'on a dans les soins intensifs. À ce moment-ci, on a 82 constellations de chirurgie non urgente dans les derniers 4 jours. Alors, au fur et à mesure qu'il y a des impacts sur les travailleurs de santé aussi, ça peut causer des changements au niveau de la capacité pour offrir des services de santé réguliers, normaux, mais aussi ça commence à impacter les services de santé urgents et spécifiques, spécialisés. Alors, c'est quelque chose que, comme le ministre Shepherd a dit, on a des réunions chaque jour pour vraiment évaluer et analyser les informations sur la capacité à horizon et à vitalité. Alors, dans des situations où il y a des capacités dans des soins intensifs, ça faut beaucoup de support. Alors, même peut-être on a des lits, mais peut-être qu'il n'y aura pas les travailleurs de santé pour supporter des admissions, soit à l'hôpital dans des chambres régulières ou à les soins intensifs. À ce moment-ci, on est correct. On sait qu'il y a des risques si les nombres de cas augmentent. Alors, dans d'autres éclosions, on essaie de gérer, d'estimer quel nombre de personnes auront besoin d'une admission, soit à l'hôpital ou soit les soins intensifs. Alors, à ce moment-ci, les calculations qu'on fait puis les prédictions sont ajustées au niveau de cas qu'on a maintenant, mais ça peut changer et on va continuer à surveiller la situation avec la capacité dans vitalité et horizon.
Merci. Louise, as-tu un suivi?
Oui, si vous pouvez, merci, faire le point sur l'éclosion dans le foyer de soins Chanex à Saint-Jean. On en est rendu où? De combien de cas, combien de personnes ont été testées? Merci.
Je crois qu'on est rendu à 11 cas dans les résidents et 7 cas dans les travailleurs de santé dans les résidences. Je crois qu'ils vont faire des dépistages aujourd'hui et dans les prochains jours. D'habitude, c'est le même protocole dans chaque éclosion. C'est tous les résidents puis les staffs sont faits chaque 2-3 jours.
Merci, Louis. Jacques Poitras, CBC.
Minister Shepherd, could you comment on the filing of the lawsuit by the Canadian Civil Liberties Association about funding for clinic abortions?
Sure, it won't be any surprise that my comment is that that anything before a court or filed before a court, we won't be commenting on. It will go through the process.
Thank you. Mr. Poitras, do you have a follow-up today?
I do. Still on that issue, the motion passed in the House in December talked about having the health authorities weigh in on whether we're following the Canada Health Act. Has that started, that process, and what's the timeline for an answer from them?
So we have had a conversation, and I can't give you a timeline, Jacques, in particularly because COVID is really right now taking a lot of our resources. But the question remains, and there will be follow-up.
Thank you, Mr. Poitras. Erica Butler, CHMA, Sackville.
Hi there, thanks very much. I was wondering if you could talk a bit, Dr. Russell, about the required testing protocol for people who are contacted by public health and told they're a close contact of a diagnosed case. Is there a standard there? Are all close contacts asked to get a test after 10 days of their potential exposure? Do some get more tests or not get tested at all? How does that work?
My understanding right now is that if somebody is contacted by public health and told that they are a close contact of a case and they have to stay home, they would be getting a test on day 10 if they're asymptomatic. And if they're symptomatic, obviously they would get a test immediately.
Do you have a follow-up today, Ms. Butler?
Yeah, it looks like today there was upwards of 1,200 test results, and about 2% of those were positive. Are you happy with those numbers? And do you think that increase is due to the required testing that's taking place with all the close contacts being reported and asymptomatic testing taking place in places like Parkland, St. John, and that sort of thing?
So our positivity rates are monitored very closely by zone and by the entire at the province level as well. And so we know that over the holiday season that there were fewer people getting tested, and so we know that our positivity rate was affected by that. And now the fact that we have outbreaks in certain areas, we know that the positivity rate is being affected by that as well. So am I happy? Am I not happy? I am very concerned that people who have symptoms, I want them to really make sure that they're getting tested when they have symptoms and staying home and not going to work or what have you. I also would like to see everybody in the province get the COVID-19 app on their phones because that will be very, very helpful in this situation and future situations. So once we get these outbreaks under control, hopefully in the next several weeks, then in the future, it probably would be easier to get things under control if everybody had the COVID-19 app. And so we perhaps wouldn't see a rapid rise in cases the way we're seeing right now.
Thank you, Ms. Butler. Bobby Jean McKinnon, CBC.
Yes, hello. Can you hear me okay?
Perfectly.
Dr. Russell, a Shannock's official told CBC News this morning that the Tucker Hall nursing home worked with public health officials to relax some of the COVID restrictions that had been in place during the initial outbreak to allow family members in to visit during Christmas. What can you tell us about how this may have contributed to the resurgence that we're seeing now?
So if I'm not mistaken, the outbreak is in a different area of, of the Shannocks model. And so I don't know that we would have that data now. Many of the cases are still under investigation by public health, and we know that from the past that this process can take, anywhere from 2 to 4 weeks. So until we actually get data in, we don't know that there has been any reason that visitation from family members has resulted in this.
Thank you. Is there a follow-up, Ms. McKinnon?
Yes, again, Dr. Russell, you said there's a positive case at Canterbury Hall in Riverview. That's also a Shannock's facility. Is there any reason to believe this is connected to the renewed outbreak at the Shannock's Tucker Hall nursing home in St. John, which began with an employee?
Not to my knowledge, but again, anybody anywhere in the province at any time can become positive with COVID-19 and is at risk of transmitting to other folks unknowingly, and those folks can transmit it to vulnerable settings. So it's not, whether it's a Shannock's facility or not, it doesn't explain that type of situation. But again, everything is under investigation right now, and when we find the index cases at any point in time for any of the clusters, we usually make that public in terms of knowing that it's travel related versus community spread, or community transmission rather.
Thank you. Sarah Seeley, Times and Transcript.
Hi there. My question is either for Dr. Russell or Mr. Shepherd.
I was just wondering what the health department's plan is for the healthcare workers in self-isolation if the number continues to rise.
So as always, those plans are certainly put together by the RHAs, the Department of Health and Public Health, to ensure that we have services fulfilled. There's always contingency plans for the necessity of having ICU beds or beds in general in the hospital to maintain surgeries. And there's always reasons, that we could result in surgery cancellations. We had a little bit of a blip this week, I think, with testing surgical patients before they had surgery. So all of these contingency plans are in place, and there are many different scenarios that could happen. But as I've stated before, during our last outbreak in St. John, where we had so many healthcare professionals out of service, we had Vitalite and Horizon partnered up. So they're there to support each other, and they'll continue to do that.
Thank you, Minister. Ms. Seeley, do you have a follow-up today?
Yes, I do. I was wondering if there was a shortage in a certain unit, if healthcare staff would be brought in from other regions of the province, and if so, how does that work now that the whole province is in the orange phase?
Well, as always, there's protocols in place to make up for any deficiencies that we have in staff. And I know the province all being in orange means that we're all following the same protocols. So the health authorities certainly know how they can operate, what they need to do to keep safe. And, they're, if they have to, they'll be testing their staff on a regular basis in the ways that they know how to do it. Vitalite and Horizon both work together to supplement each other's staffing if that's needed.
Thank you. Savannah Odd, Telegraph Journal.
Hi there. My question is for Dr. Russell. We're now dealing with 3 different outbreaks in special care or adult residences, which are obviously high-risk settings. Are you evaluating the screening procedures that are happening at these homes? And do you think anything else could be done to keep cases out?
Well, from the beginning of the pandemic, we have known that these are vulnerable settings and are a priority in terms of making sure that COVID-19 does not get into these facilities. So in each and every time we see outbreaks, when we bring the prompt teams in, if there are things that need to be done to get things under control very quickly, they do that. But the yellow phase really has protocols that all these facilities have in place and are supposed to be followed to keep everybody safe. But again, nothing is foolproof. COVID-19 is quite it's a nasty virus, and it does get transmitted quite easily. So all I can say is that in the yellow phase, all of the protocols that all of these facilities are supposed to have in place are there, but again, these are very vulnerable populations, and the transmission can happen quite quickly.
Thank you, Dr. Massad. Do you have a follow-up today?
I do, thank you, Bruce. Dr. Russell, I guess, can you describe what screening currently happens at these special care homes in the yellow versus the orange phase? I guess the main difference is, I know at the outbreak stage, when there's an outbreak declared, there is a mandatory temperature check when workers come in, I believe, but when there's no outbreak, I guess, could you describe that?
I think, to be fair, we probably should get you a good answer, a solid answer from the Department of Social Development. I know that there are screening processes in place at all long-term care facilities with regards to staff and any visiting family members. It's just from my experience there in the past, it's certainly been a difficult time for nursing homes and long-term care facilities, because even in yellow, many families could still not hug or touch. And it was really up to the capacity of each individual adult residential facility or nursing home as to how often those visits could take place, and usually not under what I would consider to be the best of conditions with regards to touching and hugging. So it's been a very difficult and long battle for our residents in long-term care and the staff. And I have to commend them on the exceptional job that they've done in keeping the morale of their residents up and for all of the hard work that they're doing.
Thank you. Marie-Ève Brassard, Radio-Canada.
Oui, bonjour. Ma question est pour Dr. Russell. En fait, Dr. Russell, si vous pouviez répéter un peu le raisonnement derrière, je pense que c'est la ministre Shepherd qui l'a expliqué, mais si vous pouvez répéter en français, le raisonnement derrière un peu la phase rouge, en fait, on va être prudent avant d'instaurer des mesures aussi restrictives.
J'ai pas compris toute la question.
Tu répétais, Marie-Ève?
Oui, en fait, j'aimerais vous entendre un peu sur le processus de réflexion derrière le fait de ne pas tout de suite aller en phase rouge pour être prudent, pour ne pas instaurer des mesures trop restrictives à la population.
OK. Oui, exactement. Alors, les déclencheurs pour avoir des discussions sur les différentes phases et reculer d'une phase, c'est 3 catégories qu'on regarde, c'est toujours les mêmes. C'est sur les niveaux d'épidémiologie, alors le nombre de cas, combien vite les nombres de cas augmentent, quelle sorte de transmission.
That concludes today's COVID-19 update with Dr. Russell and Minister Shepherd. Again, just for a recap, there were 24 new cases of COVID-19 in the province today. 5 of those were in the Moncton region, 5 in the Edmundston region, and 5 in the Campbellton region, along with 7 in the Fredericton region and 2 in the St. John region. There are currently 130 active cases of COVID-19 in the province. That's the largest amount of active cases we've had since the pandemic began. We will be staying in the orange level of recovery, and as if you noticed, Minister Shepherd did mention that there would be a conference tomorrow, so I imagine I will be joining you again tomorrow. I'm Vicki Hogarth. Thanks for joining us today on CHCO.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.